Good afternoon, everybody. Thanks a million for joining us for today's webinar on CDM Phase 2. My name's Donald O'Neill. I'm the Head of Marketing for Clonmedium Health, and with me today I have Ronan Leonard, our support team lead for HPM. The format today is pretty simple. Ronan is going to give an overview of CDM Phase 2 in your HPM system, and he's going to be covering the prevention program and the opportunistic case finding aspects of it as well. And then at the end and during it, at the end we'll take questions, but if you do have any questions that arise during it, on the right hand side of your screen you should see a little tab that says questions. If you click into that, there's a little box there. You can type your questions, they'll come straight through to me, and then I can put them to Ronan once he's done the demonstration and gone through it all. So look, I'm kind of conscious that we have a lot to cover today, so I will stop talking now, and I'm going to pass the controls over to Ronan, and Ronan will lead us through the demo.
Hi Donald, hi there everybody, and welcome to the CDM Phase 2 webinar. As usual, we get the normal housekeeping steps out of the way first. The first thing you need to check is your HPM version number, and this can be gotten from Help or About, or if you just check the top of the screen there, you'll see the version number there. The version you should be on is 3.7.0.55, so if you're not on that, give us a shout and we'll get you upgraded. We're in the process of rolling out this version at the moment, so you should have it in the coming days. And also just a couple of other things to go through around CDM Phase 2 itself. I just want to go through the requirements for each element of CDM Phase 2. So we want to go through the three different elements. They are opportunistic case finding, prevention program, and normal chronic disease management. So let's start with opportunistic case finding. It's for anyone 65 or over from the year 2022. An OCF review can take place every 5 years. The purpose of this assessment is to identify those patients at a high risk of developing a cardiovascular disease and/or diabetes, etc. When a patient attends for another issue, risk criteria can be applied, and if there's an indication, an OCF assessment can be carried out on the patient. The outcome of this assessment will be low risk and they stay in the OCF program, be high risk and they'll be registered for the prevention program, or they'll be diagnosed with a chronic disease and they'll be registered with CDM. Okay. The next is prevention program, and again, that's for anyone 65 or over in 2022. Patients registered in the prevention program will receive one scheduled review in a 12-month period. However, a PP review can take place every 9 months if it's required. An OCF assessment must be submitted before you can move the patient to the prevention program, and I'll show you that in a second. And the outcome of the PP assessment will be number 1, high risk, they stay in the prevention program, or 2, diagnosis with a chronic disease, and you register the patient with CDM. And finally, the familiar CDM, which is now for anyone 18 or over. As per the CDM contract, there'll be a maximum of 2 reviews in a rolling 12-month period, and the 12-month period is considered to be rolling 12 months from the date of the first review, and there must be at least 4 months between all reviews. And it's just something else I wanted to cover as well, Donald. It's worth noting that while all 3 of these programs we're talking about sort of 1 review, I would imagine that 1 review is actually 2 visits. The first visit is to take the bloods, and then the second one is to do the review once the bloods have come back. Okay, so now we've gone through all the 3 programs. Let's have a look at them in detail, and we'll start with opportunistic case finding. So I have a few patients prepped here, so we'll open the first patient, test OCF. And just the first thing I wanted to flag with you, for any of these reviews that you're doing, you have to do the vital signs on the day of the review. If you have the vital signs from the day before, they will not populate the review. So what we'll do is we'll go and we'll do the vital signs first. We'll go into the exam section, we'll click on new exam, and we click on vital signs, and we'll just start populating here. Pulse 80. I'm just putting anything at all in here in between the boundaries.
Yeah. No medical training.
I think I know what I'm doing. and then the waist circumference is the last one. So I've popped in the vital signs there. And we'll close out of this screen, and then obviously we go into protocols, chronic disease management, and add review. Now, the first thing you'll see when I click on add review is you have a drop-down list here that you didn't have before. We just add the review. Now you have a drop-down list for opportunistic case finding and chronic disease management. Now you'll notice that the prevention program doesn't appear here. It doesn't appear here because there's no review for opportunistic case finding already. Okay, so we'll click on opportunistic case finding and we click OK. And as you can see, you have all your details here. It brings in the patient's GMS number, the GMS doctor number, etc. All right, and then we just click OK. And indications for review, you can tick a box here we'll tick BMI greater than 30 and we click OK. Now, we'll go through it from top to bottom. We'll start with physical exam. Now, as you can see, because you've done the physical exam already, it's populated all the details. It's populated the height, the weight, the BMI, the waist circumference, the pulse rate. If these don't populate, you can click. It's the same as the investigations. You can click on the 3 dots here and you can search for it by list or by name, and you can match it that way. I'll run through that with you again in investigations as well. So we'll select the regular pulse. Blood pressure is 120/80. That's again populated because I have the vital signs in. Smoking status, we'll select never. Vaping status, that's new, we'll select never. Your Q-risk score is here. You can click on the ellipses for this. And as you can see, because I have investigations in, it's populating all the details here and it's actually calculating the Q-risk score for me. Okay, you click OK on that. And next is the investigations. Now again, this will take in bloods, any bloods that have been done, Donald, within the last 3 months.
Okay.
And it will populate them automatically. Now, if it's not populating them and you know you have done a hemoglobin or a total cholesterol, you can click again on the 3 ellipses here and search by name and do a search. If it's slightly different, it could be Anthony. You can also use a wildcard as well. So I can pop a percentage here and I can just delete the rest if I want to. And I can click on search and it'll find that there, okay? It's just in case the lab have named it slightly differently. And then when you click on that and click OK, it will ask you, do you want to match this going forward? And you select yes. Okay?
Sure.
So we'll just click on NA on that. And then the investigation. So we've gone through all the investigations. And then last really but not least on this one is the outcome. So we'll collect outcome normal. And that means they'll stay on the OCF. We select prevention program. And basically it's populating there. It's saying the Q risk is higher than 20. So we'll tick the box for that. Or we diagnose with chronic disease. And then we have an option to select which disease we want to diagnose them with. So we'll just select prevention program for this one. We go Q risk higher than 20. We'll hit save. And we'll hit submit. Just to point out as well, you'll notice that 0 fields required. So it's ready for submission now. So we'll click on submit. And it should submit, hopefully. Yeah, it's gone. And you can see there it says awaiting acknowledgement, so that's gone now, okay? So that's OCF. So moving on from OCF, we'll do the prevention program now. And it's the same again. If we go into, if I have a test patient here, we'll go into test PP. And same thing again, Donald, you have to add in the vital signs on the day.
Okay.
So we'll do that again. Won't take too long. Anyway, BMI, waist circumference is 86. Let me click OK on that. Okay, so we have done the vital signs for today. So then it's very much the same thing again. We go into protocols, chronic disease management, and you can see there's an opportunistic case finding here already. And when I click on add review, click on the drop down, you can see I have the option here for prevention program. All right, so I'll click on this and click OK. Now, as you can see, it brings in the GMS number, the doctor, etc. And then also in the specify reason section for the prevention program, it's bringing in the Q risk greater than 20. It's bringing that in from the opportunistic case finding. And you can tick other boxes here as well if you want to. You click OK on that. And same thing again, physical exam, you can see the prevention reasons are, first of all, the prevention reasons are there. And then you have the physical exam. It's bringing in the details you filled in earlier on because you've done your vital signs for today. We select the regular pulse. Risk factor, weight, the risk factor here, there's a weight brief intervention because the BMI is greater than 30, so you can tick the box here for brief intervention, and you can tick any of the boxes here for signposting to local weight management service or referring to a dietitian or anything of that nature. Smoking status, you can select whatever you want. You can select never, and then you have your ellipses here for the alcohol risk score. Click on this, and you click on the drop down here. Now you have a few options here. If I click on never, the score is calculated 0. If I click on 4 times a week, we obviously get a few more questions. So depending on your response to the first one, you get different questions, and then when you click OK, it calculates the score. So I click OK on this, and it has the score low risk. And again, physical activity, depending on your responses here, if I hit 0 days, you get different options here. Whereas if I hit 5 to 7 days, I don't get any options here. So it's dependent on your responses here, all right?
Sure,
So I
and
select.
each is determined by the one above it. Yeah, I get you.
Exactly, yeah.
Yeah.
So we select 5 to 7 days, and then you have your Q risk score here. Again, it's being calculated because I have my investigations in and I have my vital signs in. So it's calculated by default, which is great. And we just click OK on that. And then into your investigations again. So we'll just select no on this, no on this. And again, you can see the labs are populated here. I'm going to click NA for that. Hang on a second. Thyroid function test will say no. Liver function test will say no. And then we have education provided by the GP. We can click on yes. Agreed with care plan. Now, this is your care plan. So if they want to do a care plan with the doctor, you can click on this box here, and you can actually jump from outcome to care plan. There's a lot of detail here. I'm not going to go through it all, but you can fill in this from top to bottom. I'll scroll down here. You'll see there's an awful lot of information there that you can put in as a care plan for the patient. And once everything is filled in, everything that's required is filled in. You see the way that print button is grayed out? That print button will come, once you hit save, that print button will come alive and you can print out the care plan. And then you can go back to outcome and click on agreed written care plan. All right. From next one on is medications. You can do a medication review here. You can actually view your medication straight from this screen. So if I click on view, it loads up the medication screen. I have nothing prescribed for this test patient currently, but anything that would be prescribed would be here. Okay. So medication review, we click yes. And then you have prevention program outcome. And you can click on the drop down here and you just select diagnosed with chronic disease, yes or no. If I select yes, you'll have your various diseases to select. If I select no, obviously they'll stay on the prevention program for now. Okay.
Sure.
So if I click on save on this, and then I can click on submit. And there it is there, done. It's awaiting acknowledgement. Okay.
Great.
So that's the prevention program done. And then the third section we want to do is we want to go into my other test patient. We go into test CDM. I think most will be a lot more familiar with this because obviously they've been using it before. So again, with this patient, we have to go into vital signs and we have to add a new one for today. 120 over. I'm just popping in anything within the range. And we'll do the waist circumference last, which is 34 is 86 centimeters. So click OK and close. And in this patient's chart, then we go to protocols, chronic disease management, add review, and select chronic disease management from the drop down and click OK. Now, as you can see, it brings in all the doctor details, GMS numbers, patients details, all that kind of stuff. And it also brings in, if I have a condition coded in the patient's chart using ICD-10 coding, it'll bring in the condition. As you can see, the tick box is ticked already. Okay. We click OK on that. And now we have the first review. And as you can see, below the review details, we have the physical examination. And the vital signs that we've just filled in earlier are all filled in there. Again, you know, the ellipses is there. If it's not populating for whatever reason, you can click on the ellipses and you can do a search for the proper height and match it. So we'll go through pulse rhythm regular, blood pressure 120 over 80. What we'll do is we'll just go through these. Diabetes related amputation, no. Posterior tibial absent, dorsal pedis absent. Normal, normal, absent, absent. Foot review note, you can pop in a foot review note here if you want to, and you can select whether there was a retinal screening in the last 13 months. So we'll just say no. And then you have an option here. As you can see, it's like the other screens don't on anything you select here. Sometimes other stuff will appear below it if you select no. So refer for retinal screening, we click yes. Risk factors again, wait brief intervention just because the patients, in this case, their BMI is greater than 30. So we can tick a box, and we can tick those boxes as well if we want to. Smoking status, we'll say never. Vaping status, we'll say never. And then same thing again, alcohol risk score. And we'll just say never in this case and click OK. Physical activity, same thing again. We'll select 5 to 7 days in this case. And then this is new. I want to show this to you. So we have influenza vaccine, we have pneumococcal vaccine, and we have COVID vaccine. Basically, if you have a pneumococcal vaccine or an influenza vaccine added to the patient's chart in the immunization section, it will automatically populate here. Now, you can select yes, and you can pop in a date manually. But in this patient's chart, I actually have the pneumococcal vaccine just added as a vaccine in the immunization section, and it's actually brought it in automatically, so it'll save you a bit of time. The COVID vaccine does not get populated automatically, and the reason for this is if I select yes, it's not a date, it's the COVID vaccination, it's more a status. So you select the status and a COVID vaccine status up to date, and you just select yes.
Okay.
Okay. We select no on this. The Q-risk3 score, we'd click on this again, and same thing again, because I have the vital signs and I have the labs all filled in, it's calculated it for me, and I just click OK. It's worth mentioning as well that obviously these labs will be different depending on the condition, but I think most people know that, that depending on the condition assigned, the lab requirements would be different. Okay. We click on these, so you can see that they've all pre-populated because we've had labs come back for this patient within the last 3 months. Thyroid function test will say no, liver function test will say no, and then education provided by the GP, we can say yes. Referred for education program, we'll say yes. Refer all details, and we can just say refer today. And then again, we have the same thing here. We have agree written care plan. So again, you go into your care plan, you scroll all the way through this care plan, fill it all out, click on save down here. And then once you click on save, the print button comes alive and you can print out the care plan. And then if we go back here, we'll select agree with care plan. Medication review, same thing again. You can view the medication and you can say whether there was a medication review or not. I'm just going to say no in this case. And then you have 0 fields required now, and you're ready to save and submit. So then we just click on save and then click on submit. And there we go. That's very quickly said. Come back with awaiting acknowledgement. So that's really the 3, sort of an overview of the 3 of them. So I just want to go through as well. That's the 3 of them done now. What I might do is just show the dashboard again. I'm sure you're all familiar with it, but it's just a refresher. So to access the dashboard, you go to tasks, claim tracker, chronic disease claim tracker. Now there's one thing that's been added here really, and it's the type. So you didn't have this option before, but now you have a type you can search for. So if I select the status of awaiting acknowledgement and the type OCF and hit search, you can see I have 2 here, okay? Or if I select CDM and hit search, I have 1 there. Or if I select nothing selected here and hit search, they'll all come back. That's really it, Donald, to be honest. I mean, I don't know if I've gone through that a bit too fast, but I think, a lot of it would have been covered, already with CDM. So I don't know, Is there any questions coming in so far? Or?
There's a few, Ronan. Yeah, no, and look, firstly, thanks a million for that. I think it was a really comprehensive overview and really kind of clean and easy to understand as well. It all seems to be quite straightforward in terms of how the guys have actually built it. You know what I mean? So hopefully it should be easy for people to start using and kind of run with it.
The main thing is the prep. If you have the vital signs done and the labs done in advance and you have them pre-populating, it takes a lot of work out of it,
Sure.
because it brings the labs in automatically, it'll bring the vital signs in automatically, and it should be just a question of just going through the review quite quickly and then submitting it,
Excellent. Well, look, we'll plow through the questions anyway and keep going. Yep. So if anyone else does have the question, please do type it in and we can add it to the list for Ronan. But first off, how often can a prevention program be done? For example, if someone has a patient that they're concerned about and they want to keep a close eye on it, can they do it, very regularly, or is there any kind of requirements around that?
Yeah, the requirement is 1 review every 12 months, but you can actually do a review every 9 months if you deem it an actual requirement. It will allow you to do a review every 9 months.
Okay, okay, cool. And then next question, can you edit a visit after you've saved it? Say, for example, if you forget to add a disease.
You can. You can
Okay.
edit a visit after you've saved it, but you can't edit a visit after you've submitted it. Okay?
Oh, I
And
understand. Okay.
that's the most important thing. As long as it's not submitted, you can go in and you can edit it, and you can do whatever you need. You can add a disease or whatever. If you've forgotten to add a disease, you can. But once it's submitted, you can't edit it. And it's worth noting as well that once you've said that you can't remove a disease. In the
Okay.
CDM review, you can't remove one. Okay.
Okay. Okay. So kind of rule of thumb there would be save it, review it, and sort of make sure you're happy before you click
Make sure
submit, you
you're
know?
happy before you submit, because the cutoff that you've submitted it then to the PCRS, it's gone.
Okay, I get you. Okay, I get you. And then another question, is there any report that would collate all the CDM phase 2 patients in a practice that would be, say, due a visit in the future?
Yeah, that's on the way. I was talking to development about this yesterday. That's coming hopefully in the next while, and we can roll it out to sites. It's going to be an ad hoc report, and basically we're hoping that it'll bring back, after you've added your first reviews for OCF and PP and CDM, this report should bring back those patients as and when they're due a review. It'll bring back patients that are due a visit again in the next month or in the next 2 months. So you should have an option to select a date range. But that's in the pipeline. I was talking to
Okay,
development about it yesterday, so.
great. Sounds good. And look, we've had no other questions come in as of yet, so I think we can probably wrap it up there, unless there's anything else you want to flag, Ronan, or you're happy enough.
No, I think let me have a look actually, just because I do have notes here that I go through. I just want to make sure I've covered everything.
Sorry, while you're doing that, I will say as well, just to remind everybody that the version number that Ronan showed at the start, 3.7.0.55, is the one that you need to be on. And I know Ronan and his team are currently rolling that out to everyone as quickly as they can. So hopefully it should be with you within the sort of the next week or so, but if not sooner. But I suppose that's how you know that you have all of this functionality that when you see 3.7.0.55 up the top of your screen.
All right. No, I think I've covered everything. I think that's it, Donald.
Great, great. And look, for everybody, thanks a million for joining us. As always, I've recorded this session and I will add it up on YouTube. So if any of your colleagues or the teams in the practice are looking for information on it, we can point them to YouTube. And I'll be sending out an email tomorrow with a link to the recorded webinar, and then links to some of the support docs as well that the guys have kindly put together for you all. So hopefully our goal here is to make this as easy as possible for you guys to start using straight away, and hopefully between the webinar and the support docs, you should be able to get up and running as soon as you have version 3.7.0.55. We need to talk to the guys about changing the version numbers around.
It's just 3.8. That's it.
Yeah, yeah, we'll round it up. Okay. Well, look, honestly, thanks a million, Ronan. That was great,
No
and I
worries.
think hopefully everybody found it useful. And thanks again to everyone for joining us today. And yeah, best of luck when you do start using CDM2, and I hope it all goes very well for you. Thanks, everyone. Bye bye.
Thanks. Bye.
Cheers.